cherish and live with the memories.
More than 2 months after an Edmonton father died while waiting nearly 8 hours for care at the Grey Nuns Hospital, a promised urgent solution of posting triage doctors to help patients in busy ERs still has not happened.
Now we're just at the point where there's a disagreement on compensation, which we are working through in a collaborative spirit with the AMA.
Can I just...
Yes, sure.
Can I just add, we keep getting asked that. I would just suggest you ask the AMA.
But the Alberta Medical Association firing back at the minister and premier. The doctors' union writing in response, contrary to what was stated in a government press conference today, the delay has not been on the AMA's end and is not solely related to the compensation rate. The AMA says the government's offer did not align with their master agreement, and there is confusion over which health ministry they need to deal with on different parts of the deal.
They don't have any good track of working with anyone.
The NDP alleges the government would rather spar with unions than negotiate in good faith.
We're talking about people dying in hospitals while waiting care. It's not a time to play a blame game. It is a time for a solution. It's unfortunate the government is incapable of doing that.
Less than 24 hours after the premier's comments, the hospital's minister tried to turn the temperature down. Matt Jones says he's still committed to signing an agreement during meetings this month.
Yeah, certainly not blaming the AMA. In fact, I met with the AMA. They recommended the position, and I implemented it and budgeted $20 million over 2 years to implement it at up to 9 hospitals in Alberta.
Outside of one of those hospitals Tuesday, frustration with the government.
Maybe open up bed spaces, pay doctors what they're actually worth, and stop screwing around with our money in the healthcare system.
This man was actually born at the U of A, but had a bad experience during a more recent visit to the ER.
I remember being sick, and it was totally full, but I think I ended up just leaving.
If a deal cannot be worked out with doctors, Minister Jones says they will look to nurses or nurse practitioners to fill the role. He also said they may boost funding to the busiest emergency rooms. Sean Amato, City News, Edmonton.